The Universal Coverage Scheme, or UCS, was a healthcare program in Thailand, which is an idea of Dr. Sangwan Nitayalampong. He recognized the problem of the welfare system and the health security of Thailand, inequality problem, and control the cost of medical treatment problem. This policy was approved in 2001 by Thaksin Shinawatra, who was a former Prime Minister of Thailand at that time. In 2001, before persisting with a universal coverage scheme, Thailand has 4 systems of welfare and health insurance for people. First one is a welfare and medical treatment system for government, official and state enterprise. Second one is the social security system. Third one is the voluntary health insurance system or health care scheme. And the last one is public health welfare. All of these 4 health care systems can cover only 70% of all people in Thailand. Still approximately 20 million people who don't have any health insurance. This one is the main reason to motivate the government to expand the health welfare system to cover all Thai people.
This part is about the detail of Universal Coverage Scheme. The Universal Coverage Scheme is a policy which provides health insurance for Thais. At first, in 2001 until now, people needed to pay 30 baht to access healthcare from government hospitals or the member of NHSO hospital. This healthcare policy covers many healthcare cases: outpatient, inpatient, oral health, and also include high-cost diseases such as cancer, HIV, and heart surgery. This policy does not cover essential healthcare such as plastic surgery and organ transplantation. There are 4 main objectives of Universal Coverage Scheme. Firstly, equality in the distribution of health expenditure, and people can access the same standard of healthcare. Next, more efficiency of healthcare service. Use result in the most effective way to reduce the cost and increase the standard of healthcare service. Moreover, make the healthcare opportunity. Patients have the right to choose variety and effective healthcare services by themselves. Furthermore, creating good health for people. The Universal Coverage Scheme heading toward creating good health by focusing on the part of healthcare services. The procedure of Universal Coverage Scheme. People can register to get the right of 30 baht healthcare scheme at government hospital in staying area. In 2001, people needed to pay 30 baht a time to access the healthcare treatment, and patients needed to carry a gold card to verify. In 2021, people no longer need to carry a gold card to verify. They just need to carry a Thai national ID card. In addition, since 2021, patients can access healthcare in every hospital. People can change the hospital to access only 4 hospitals per year. In 2021, the budget each person increased to 3,600 baht.
There are many advantages that Thai people get from this scheme. To begin with, this scheme increased the health insurance to Thai people almost 100%. Next, this scheme helped decreasing the cost of health expenditure for Thai people, especially poor people. Moreover, this scheme will increase household consumption for other use instead of using in health expenditure. This is because this policy helps reducing the cost in health expenditure and people have less burden in this cost. In addition, this scheme also helps decreasing in infant mortality as well. The reason is the poor pregnant can meet and use the hospital to give birth safely and then pay only 30 baht. However, there also are disadvantages in this scheme as well. Firstly, due to no limit of time in treatment, it makes medical officers have overload work. Secondly, this scheme is unfair for those who use the Social Security scheme. This is because this group of people need to pay for healthcare insurance every month. Thirdly, some low-income households not only pay 30 baht fee, but also need to face the opportunity costs such as cost of transportation. Next, the patient can use this scheme only in official working hours, which is 8:30 a.m. to 4:30 p.m., except the emergency case. Finally, the Universal Coverage Scheme cannot be used with private hospitals. As a result, there is a difficulty for those who live far away from the public hospital, primary care institution, and NHSO hospitals. In details, the Universal Coverage Scheme can be used in private hospitals and non-NHSO hospitals only in emergency case. Moreover, it only covers for the first 72 hours.
For the next part will be the suggestions. Our group suggests that the government should cooperate with the hospital to make a better plan for medical officership, so the work will not be too overloaded to each medical officer. For the second suggestion, the government should be fair to everyone, which is the government should let everyone pay the health insurance at the same price or not correct them at all. As for the budget that we use in this scheme, the government can correct them from the tax that everyone already needs to pay. For the third suggestion, the time that used in this scheme should be allowed to use for 24 hours. This is because we will never know what's going to happen to us, what accident we're going to face, or when we're going to feel unwell. Lastly, the government and the Ministry of Public Health should cooperate with each other to expand the hospital to community as much as they can, so the poor people don't need to face the opportunity cost such as transportation.